Welcome to this explainer. Okay, we're diving straight into a topic today that is, well, it's just as biologically fascinating as it is physically terrifying. We're talking about kidney stones. But more importantly, we're separating the hard biological facts of how they actually form from all those common myths and unproven remedies floating around out there. If you love clear, structured information that gets right to the truth of how our bodies work, you are in the exact right place. So let's get into it. Picture this. You wake up in the dead of night, and suddenly, boom, there is this intense, knife-like, literally unbearable agony on one side of your back, and it's radiating right down into your lower abdomen. It's so severe that doctors actually frequently compare it to the terrifying pain of going through labor. Seriously, it's no joke. That is the reality of a kidney stone attack. It's not just a minor ache, it is an overwhelming, systemic shock to your entire body. And you know what makes this absolutely crucial to understand? The sheer scale of it. The source material points out that 1 in 10 people will experience this problem. 1 in 10. That means if it hasn't happened to you, it's highly, highly likely it's going to happen to someone you know and care about. So we really need to understand exactly what the heck is happening inside the body. Okay, let's dive into this. A kidney stone is obviously not like an ordinary pebble you'd pick up off the sidewalk. Your kidney's main job is basically to act like a filter. It filters your blood and removes waste through urine. But when we get dehydrated, or maybe our lifestyle choices aren't the best, certain substances in our urine, specifically things like calcium, oxalate, or uric acid, they stop getting flushed out. Instead, they kind of just hang out and accumulate in one spot. They form these tiny crystals which slowly fuse together over time to take the shape of a larger stone. It is literally your body's waste calcifying right inside of you. But how does this build into an actual medical event? Well, it happens in steps. Step 1 is totally insidious. The stone just forms quietly. As long as it sits still in the kidney, you feel absolutely zero pain. You don't even know it's there. But step 2, that is where the nightmare starts. The stone begins to move. And this triggers step 3. That severe wave-like pain from the middle of the back right down to the abdomen. Next, you hit step 4, a burning sensation when you pee, where the urine can actually turn reddish, pink, or cloudy. And finally, step 5, the pain is just so intense it triggers severe nausea and vomiting. So the real question here is, why does this happen? We unknowingly make daily mistakes that fuel this exact crystal formation. The primary culprit? Drinking less than 3 to 4 liters of water. But it's also eating excessive raw salt or heavily salted foods. It's the frequent consumption of those cold, sugary drinks we all love. And it's a high intake of red meat, like beef or goat, which directly spikes your uric acid levels, basically creating the perfect environment for these stones to form. Now, what's really interesting about this slide is it brings us to the absolute biggest misconception about kidney stones. We call it the calcium paradox. The common myth out there is that since many stones are made of calcium, you should just completely cut out dairy and calcium-rich foods. Makes sense, right? Well, actually, scratch that. The medical fact is the exact opposite. If you drastically drop your calcium intake, a substance called oxalate will rapidly build up in your body. That oxalate goes straight to your kidneys and forms even bigger stones. You literally need the right amount of dietary calcium so your body doesn't absorb all that excess oxalate. Because the whole idea of surgery is incredibly daunting, the source material explores some alternative approaches. We're going to look at these impartially, just to understand what's actually being claimed. The first approach the source brings up is an Ayurvedic treatment, specifically a combo kit by Ujjwala Ayurveda Shram. The core philosophy here is an herbal formula designed to maintain the balance of the body's 3 doshas, Vata, Pitta, and Kapha. Let's break down exactly what the source claims this specific combo kit, which is made of cadanol and livgon, actually does. They make 4 distinct claims here. First, dissolving stones, asserting that herbal ingredients like curasani and mangista basically flush stones out via urine. Second, liver protection, claiming the capsules detoxify the liver and improve digestion. Third, uric acid control, aiming to reduce those excess levels we talked about a minute ago. And fourth, pain reduction, claiming to soothe that unbelievable internal inflammation. Now remember, these are simply the functions claimed by the manufacturer and our source material. If someone were to actually follow this Ayurvedic path, the source gives very specific dosage instructions, taking the capsules before meals, the syrup after meals, that whole routine. But I really want to draw your attention to the final point here. Even the source heavily emphasizes that the duration of this course depends entirely on the size of the stone. Because of that, you absolutely must consult a registered doctor before starting anything like this. That is a super critical caveat to keep in your back pocket. All right, so alongside those Ayurvedic kits, the source also presents a handful of at-home dietary remedies. But as we transition into looking at these, we really have to weigh these natural remedy claims against the ultimate, undeniable biological fact of kidney stone prevention, which is hydration. Let's take a look at these specific natural remedies and the chemical benefits the source attributes to them. Warm lemon water is suggested because it contains citrate, which the source claims prevents and even breaks down small stones. Then there's a mix of tulsi leaves and honey, claimed to have compounds that keep your uric acid in check. Apple cider vinegar is cited for its citric acid to supposedly soften stones, and pomegranate juice is highlighted for antioxidants to detox the kidneys and reduce internal burning. Now, while these are super common natural health practices, it is so vital to remember these are just claims when it comes to effectively treating already formed stones. And this brilliantly illustrates what the absolute, undeniable baseline of treatment and prevention is. Guys, there is no alternative here. There's no shortcut. The absolute most powerful medicine for kidney stones is water. You simply must consume 3 to 4 liters of water a day. If you fall into that dehydration zone, stones form. It's that simple. The more water you drink, the more urine your kidneys produce, and the faster those tiny crystals inside are flushed out way before they can ever become a nightmare. Which brings us to our final and honestly most important reality check today. While proper hydration is a hard medical fact, claims that lemon juice, tulsi, or specific herbal syrups can literally dissolve fully formed stones, well, they lack solid clinical evidence. The reality is, treatment depends entirely on the stone's size, its specific type, and exactly where it is located in your urinary tract. So I'm going to leave you with this thought to consider. When you are faced with a pain that literally rivals childbirth, and a condition that completely depends on internal millimeter measurements, would you rather rely on a home remedy to try and dissolve it, or trust the clinical imaging and expertise of a doctor who can actually see what's happening inside you? Thank you so much for exploring the facts with me today, and keep making those informed, structured decisions about your health.